I'm Dr. Anna Juricic. I'm a low vision optometrist in Toronto, Canada. Today, I want to talk to you about different glare filters. So many people living with vision loss are actually bothered by both outside glare from the sunlight and also indoor glare. So when I see my patients, part of my examination is where I assess if the indoor glare and outdoor glare is bothersome. And one way for me to know if glare inside is bothersome is I actually put in front of the patient various blue blocking filtered lenses. And the blue blocking lens can help actually filter out that indoor glare. And I always will test to see if something like this can make a difference. And it's an immediate response. Either the patient likes it or they don't. It's the easiest test I can do in my examination. I will still recommend the blue blocking lens, except I'll go with the clear version. And that's to help prevent some of the damage at the macular pigment level, especially my patients who have early changes with macular degeneration or do have the signs of macular degeneration. And now that we use a lot more computers, we're on our smartphones, we're on our tablets, we know that there's a lot more direct blue wavelengths of light coming off of these screens. And these filtered lenses can make a difference. So for people of all ages, even the kids who are using these computers and their cell phones for many hours in the day. And for patients who don't need to have prescription lenses, there are the options of getting fit-overs. And so the fit-overs, they do have the ones that are lightly tinted with a blue blocking lens. So it has that yellowish tinge, so there's a little bit of that calming effect if it makes a difference for my patients. And I find that about 60% of my patients do appreciate having that tint with their blue blocker. Some of my patients actually appreciate more the bright yellow. So this actually cuts the blue wavelengths of light at a different point of the spectrum. And what it will do is it'll help improve contrast and take away glare at the same time. And I often tell my patients if they like something like this, it'll make a difference on those gray overcast days. If it's a bright sunny day, they'll really want to go to a darker sunglass. But this can make a difference going into some of these bright stores. If you go into the grocery store, they have a lot of the bright LED lights, and it can be too intense for some people who have glare issues. They can put these filters on when they're in the store, or if they're at home, there's a lot of light coming into the room and they find it's bothersome. Others appreciate more going into various orange tinted lenses. So this is a darker orange. And so certain conditions like albinism and retinitis pigmentosa, this color may be more soothing, especially when they're outdoors, where it gives them that higher contrast and it takes away glare. But when it comes to sunglasses, one thing that a lot of people don't realize is that many people have a preference to the best sunglass tint for them. And the way you know is I always say, you want to be trying on both the amber or brown sunglass tint versus a gray sunglass tint. Now these are fit-overs, but you can also do non-prescription ones, and I recommend going into the polarized version in that case. And if you do need prescription eyewear, you can do it into, the optical can actually make it into a prescription as well. But when somebody has macular issues, they normally will do much better with the brown or amber tinted lens, because again, it's going to help improve contrast, take away that glare from the outside sun. But others will actually prefer more the gray, and the gray will actually keep colors out of even distribution while filtering out that glare from the sunlight. So that's your little 101 on choosing different glare filters and sunglasses to make a difference when you're spending that time outdoors, or if you're having issues with indoor glare as well.